So continuation with the glucose tolerance test, alternative test is also required for HbA1c test. So Hb is a hemoglobin level. So how the glucose is present in the hemoglobin level. So blood test that shows normal average blood sugar glucose level for the past 2 or 3 months. And this HbA1c is mainly used to diagnose type 2 diabetes. Type 2 diabetes, it is also called as insulin resistance, or it is insulin independent diabetes mellitus. So this should be used to monitor blood glucose control in people who have diabetes. So people with diabetes are advised to take this HbA1c test for every 3 to 6 months. So for every 3 to 6 months we have to check regular basis for the hemoglobin glucose, such as HbA1c test. So this test can show average glucose level for the past 3 months, because high A1c levels is a sign of high blood glucose from the diabetes. So it can also cause serious health problems, which also includes heart disease, kidney disease and nerve damage. So it is also not only causes the diabetes mellitus of type 1 and type 2, but it is also affects the other parts of the body, and it leads to the stroke, heart disease, whereas blood should not be passed into the heart, kidney and nerves. So the proper blood circulation has to be maintained all over the body, or if any improper transport or improper functioning of the blood in our organ, so total organ damage will occur there. It mainly affects the heart, kidney and nervous. So nervous, the brain will affect immediately. And the other names of HbA1c test is the A1c test, glycohemoglobin test, glycated hemoglobin, glycosylated hemoglobin test. And this A1c test may be used to screen or diagnose only the type 2 diabetes. So type 1 we don't want to diagnose with HbA1c, only type 2 diabetes is required. So with type 2 diabetes, our blood glucose gets too high because our body does not make enough insulin to move blood sugar, because this is the insulin independent. So it does not avail insulin function to move the blood sugar from our body into the bloodstream. So our cells stop responding to insulin. So in case HbA1c test is required. For pre-diabetes test, pre-diabetes means that your blood glucose level is higher than the normal, but not high that much enough as with the diabetic patients. So here only the lifestyle changes, such as healthy eating and eating the balanced diet and nutritional food and doing exercise may help delay or prevent pre-diabetes from becoming type 2 diabetes. So pre-diabetes is the condition where we can cure within the month of 2 or 3 months by properly following the exercise and healthy nutrition uptake of our body. And the normal ranges, so when coming to the HbA1c normal range, when normal people having the below 42 millimolar per molar, it is indicated as percentage. Below 6% of HbA1c is normal. And coming to the pre-diabetic patients, 42 to 47, that is 6% to 6.4% is considered as pre-diabetes. So when above the 6 to 6.4, it is considered as pre-diabetes, and for the diabetic patients it is 6.5 or over. So more than 6.5% will considered as diabetic patients. So that is in mentioning as millimolar, 48 millimolar per molar or more. So above 48 is considered as diabetes. So by seeing the HbA1c test, these are the important points you should have to take the HbA1c test for every 3 to 6 months for preventing the disease such as health problems including heart disease, kidney disease and nerve damage, and what are the alternative names. And this test is screened only for if the person has type 2 diabetes or insulin independent diabetes mellitus and pre-diabetic patients. And these are all the normal values which could be maintained in the HbA1c in our blood, and it should be maintained by following the normal healthy diet and doing yoga. yoga or exercise or meditation, it just completely gets our body into normal.